Welcome to the Therapist Thrival Guide. My name is Miranda. I am here with Amber and Sable, and we are talking about working with the queer community and working with people that are kind of struggling with different identity issues or LGBTQ issues, all those sorts of things. And so wanting to jump into this conversation, but first I'll let you both introduce yourselves. So Sable, do you want to go first?
Sure, I'll go first. So my name is Dr. Sable McElveen. I am a licensed clinical social worker supervisor, so LCSWS. I also have a doctorate in health administration focusing on diversity, equity, and inclusion with diverse populations within healthcare and how to best achieve patient satisfaction from diverse communities. And I am a clinic director with Ellie Mental Health in the Houston area in our Tanglewood location.
Awesome. Thank you so much for joining. Amber, do you want to go ahead and introduce yourself too?
Yeah, I don't have a big as lineup as Dr. Sable over here, but my name is Amber Silva. I use she, they pronouns. I am the co-clinical director in the Ann Arbor location with Ellie. You might hear Kayla, my other co-clinical director, on some of the other podcasts that might be coming out. But yeah, I am an LLMSW. I am EMDR informed. And just some background, since we're talking about LGBTQ population, I identify as non-binary, asexual, and pansexual.
Awesome. Thank you so much for joining. And thanks so much for sharing that, Amber, too.
Absolutely.
Yeah. I am so excited to talk about this because we amazingly in like 50 episodes have really not dove very deeply into any sort of topics around LGBTQ community, which is bizarre to me. First off, I can't believe we haven't done that. And so excited to kind of dive into this topic more. And I'm wondering if a place that we can start is maybe just talking about why is it important that we're dedicating a podcast episode to this? And I think that might be a nice tangent too into some of your research, Sable. And so curious about why do you two think it's important we're having this conversation?
Well, I can certainly start. It's both a beautiful thing and a important thing to notice why you guys maybe haven't focused on this particular topic, because it is so beautifully accepted now in many, many different types of communities, especially in a therapy space. Mm-hmm. We try and create these affirmative environments where clients can just share themselves with us. But we know that not every place is going to be as accepting or as open as a therapy relationship and environment can be, which is why it's really important to get this information out. There's a lot of different reasons why it's crucial to talk about this. And one of the biggest ones is the fact that there is still bias and stigma when it comes to LGBTQ IA plus identities. There's so much research even coming in the last couple of years regarding the types of discrimination that people are facing still. While there are some federal laws in place, we still know that even if you are assumed to be part of the LGBTQ plus community, you are treated differently and often unfairly. Because, as Amber identified herself, I also identify as pansexual and queer, she, they pronouns. But by looking at any one of us, you really wouldn't be able to tell that. But as soon as you announce yourself, sometimes people do still treat you differently. There's a lot of different areas in our lives where people treat us differently, whether it be at work or at home, whether you are someone who is still trying to figure out their identity as a teenager or even younger. We know that children who are identifying as trans come out even as early as the age of 4 years old. And a lot of parents don't understand how to take that. They think it's just, fantasy talk and it's just, it'll pass. It's a phase. Yes. But we know that there's so many times where they stick with that. And that is who they are. So it's incredibly important to not only talk about the ways in which we show up in the world, but also the ways in which the world treats us. And unfortunately, it can come from our own families.
Yeah, absolutely. Amber, I don't know if you're nodding so much. So I'm
I know, I'm
curious if
like,
you have
yes,
any other
yes,
thoughts to
yes.
kind of add to that.
No, but to add on to what Dr. Sable was saying, luckily we live in a world where it's starting to be more accepted, but obviously, as Dr. Sable was mentioning, there's still some backlash and things like that that are still plaguing our society. And I'm glad that Dr. Sable and I took some time to also talk about what we identify as, because I think that's also important to the therapeutic relationship. Because if you're also going into
Mm-hmm.
a room, you want to be accepted in all parts of your identities. And I think, not therapists aren't entitled to share what they identify as, but I do think it adds to the therapeutic relationship to make that client feel safe, especially if this is a stranger. I don't know how they feel about certain things. Not that should be
Yeah.
a topic of conversation, but it's reality. So I think that
Mm-hmm.
creates a safer environment too, just so people are aware of who they're working with.
I love that you brought that up, because that was going to be one of my first questions, where if you have a client that is maybe brand new, at what point do you disclose parts of your identity like that? Or at what point, or do you just kind of have that, or do you ever? I mean, I'm just curious kind of how do you navigate the self-disclosure part of that?
Yeah, I make it a priority in my relationship with my clients. Some therapists can not disclose anything at all. That's totally okay too. It depends on your comfortability. However, I prioritize if someone's spilling their guts to me, I might as well just share a little bit if that's what they want. I don't share what isn't asked for. Typically at the end of my sessions, particularly the intake session, I ask about their history. Do you have a partner or partners? Do you identify as something that I should be aware of? What your relationship's like, so on and so forth. And typically at the end, okay, like, is there anything that you would like to know about me? Do you want to know about what I identify as or anything like that? Just to make them feel safe. I also use my pronouns and other things on where I promote myself, like Psychology Today, or even on our LE Mental Health website, using she, they pronouns too. So that also gives a buffer too of like, oh, okay, Amber seems like she could be a safe individual starting therapy with in terms of those demographics.
Yeah, you mentioned something really important twice there, which is that feeling of safety.
Yes.
I know that is something that we try and establish right from the get-go. And I know a lot of therapists are always, especially new therapists, they're a little antsy about self-disclosure. And we're taught from day one that we have to be very careful about self-disclosing. But chances are they are coming to us because we have identified ourselves.
Absolutely.
And we do understand some of the stigmas that they face. And we at least have some knowledge of maybe what they're going through. And so that immediately has some sort of a bond or a kinship. I mean, we certainly know that there's no community is monolithic, whether it be racial or ethnicity or LGBTQ populations. It's not monolithic at all, but it's at least a place to start with. And it's a way for us to connect on a deeper level. So I too try and disclose it with a client who also identifies as being part of the LGBTQ plus community. Say that 5 times fast. We're going to be saying it a lot, huh? But I try my best to, especially if they mention it in their intake paperwork, we have a little bit of a clue if they do identify. But then, of course, it may not necessarily be the reason why they're coming to therapy. So there's been plenty of times where I've self-disclosed at the end of a first session or an intake session. But sometimes it's taken, a good 5 or 6 sessions for some clients to really understand or maybe start connecting the dots on how their LGBTQ plus identity has impacted them. And then it becomes a point of conversation for me to really dive deeper with them into who I am and how I can best support them as another member of the community.
I think you highlighted a couple of really important parts there, where I think that there are ways that we can, if you're a clinician that's maybe not super comfortable with disclosing right away, there are still a lot of ways that you can show that you're a safe person, whether it be having really inclusive intake paperwork, giving lots of opportunity for people to kind of share various parts of their identity, as well as, like the art that's hanging in your clinic room, the stuff in your Psychology Today profile. All of those different areas are are opportunities to show that you are somebody who is an ally or is a part of that community. And so I think, I think that's great. Curious too. I mean, I've had a couple of episodes recently with some of our autistic therapists, and they've talked about how helpful it can be to have, if you are neurodivergent yourself, then to see a clinician that's neurodivergent. And that kind of goes into your research, Dr. Sable, where, how people might, like how their outcomes can be tied to, feeling safe with a provider, having a provider that looks like them or is a part of their community. I'm curious, did some of these different issues come up in your research as well? I'm not like asking this well, but like, what did you see in your research around this topic?
Yeah, I mean, it came up quite a bit. And thankfully, I was actually able to find several people who did identify as being trans or gay or lesbian or non-binary in my pool of people that actually took my research survey. So I was so happy and surprised and thankful that they took the time to do that, because it's not diversity without LGBTQ talk. So there were several people that mentioned how, of course, it's still a minority within a minority, right? So you have not only power structures that come up within LGBTQ plus communities, because they're also facing racial discrimination on top of gender discrimination, on top of other discriminations. But it was very clear that a lot of them were very thankful, and many people really wanted to serve in healthcare because of the fact that they identified as part of these communities and it wasn't being represented in their own lives. And so it was crucial for them to be a part of these opportunities to not only serve clients who they can identify with and clients who saw themselves all the way from, a CNA to a CEO that actually looked like them and sounded like them and, used the same, gender pronouns as they did. But it was also incredibly important for them to be part of a team where it is typically, unfortunately, not very diverse within medical teams to have gay, trans, lesbian, non-binary folks as part of the team. So having them be a part of the team is not only an opportunity for them to serve their clients, but also serve as an education opportunity too. We talked a little bit about this during our podcast, but not everybody is obviously going to be the type of person who is the educator in any type of minority group. It's not our role to tell people. There's a lot of research. Google is a wonderful thing nowadays. You can find your own research and do the work. But it is really nice for those of us who do want to educate other people within healthcare about serving minority and LGBTQ populations and actually have a captive audience usually too. And that's the key as well, having that captive audience. A lot more people in healthcare are more willing to talk about this because it is much more out in the open. And we do have people that are outwardly expressing their displeasure and their history of mistreatment too. So I saw that a lot in the research where people were identifying the fact that they were able to serve as a guidepost for their teams, to serve as someone who can teach them a little bit about the different communities that they may represent.
That's such a, we talked about this in the other podcast episode where I feel like I could just listen to you talk about your research for hours just because it's so fascinating and so crucial. I'm curious too, as you were doing your research, did you find, and well, maybe just in your personal work with clients too, do you find that people in the LGBTQIA plus community seek you two out specifically because of that part of your identity? Or do you find that, or is that not necessarily the case?
I won't speak long on it. I know for me, it's a mixed bag. Sometimes it's not only finding someone who, because I have a lot of check boxes when it comes to different types of communities I represent. So there's several people who are seeking a Black therapist. They're seeking a Black queer therapist. They're seeking a Black queer female therapist, or, a she, they pronoun therapist, therapist. So there's a lot of different reasons why people may come to us. But there's been plenty of times too where someone is not really seeking that, but then it kind of comes up. It does, because it's, again, we've created that safe space where I've identified myself, and they're able to maybe give me a little bit more insight into themselves because they know they won't be misjudged or mistreated, possibly as they've been in other situations.
Yeah, and just to speak on that too, I mean, I have, different demographics and stuff like that I also play a role in. But I think too, I work with kids a lot often. And I think that that's a really specific, like LGBTQ with kids is another topic that's not really talked about specifically. So I think, that's one role, because most of my kiddos I have that are around the ages like 12 and younger identify as some type of LGBTQ identity. So I think that's really interesting to see too. I don't know how they found me, but they found me, whether that be LGBTQ, whether that be I work with kids. So it's really interesting to see how that plays a role.
So a couple months ago, we came out with an episode that was specifically about doing couples therapy with polyamorous couples. And one of the takeaways that I had from that particular episode was just how doing couples therapy with poly, I shouldn't say couples, but doing therapy with partners that are in polyamorous relationships is you're dealing with the same issues as you're dealing with every other individual therapy session or couples therapy. I mean, it's like, just because you're a part of one of these groups or identities doesn't mean that you have a whole new set of, issues that you're working on, or, things that come up in your relationship. And so I wanted to caveat with that. However, I'm curious how you two go about kind of exploring identity stuff with some of these clients, especially like maybe if they're just starting to explore or just starting to kind of question or wonder. What are some ways that you help clients kind of through that journey?
Amber, I'll let you start.
Thank you. Yeah, I think for the most part, it's listening to your body and listening to yourself. I can't assist you with how you feel, but like if I'm thinking about trans clients, if you're feeling suicidal or really, really depressed by looking at yourself in the mirror and not feeling comfortable in the body that you identify. Okay, well, let's break that down. Why do you feel depressed and suicidal when you look at your body? What can we do to navigate that? Again, we're working with kiddos. Sometimes that's a lot more difficult than to address with adults, but taking that of like, okay, well, what are some things that we can work on in this moment? How can we navigate those suicidal thoughts or depression, or more to sum that up, gender dysphoria, specifically with the trans folks, but looking at it as a whole of what are the presenting problems? And we kind of talked about this earlier of like, sometimes the presenting problems that these people come in for are results of their identity. So I think taking it apart and looking at what's at the core of why are you here and what's the background of that, starting there, if that makes sense.
Yeah.
That's actually a really good point. I'm glad you mentioned that, because so many times, and there's a ton of research out about this, where a lot of substance use issues, increased rates of depression, suicidality, all of that is connected at higher rates with people that eventually do identify as LGBTQ. So it is all wrapped up in self-identity and self-perception and self-esteem. But that's a really good segue into talking more about, again, creating those safe environments, and really allowing a client to be the one to kind of guide the session. I think in straight communities or non-LGBTQ communities, we talk a lot about the fact that I am not here to tell you what to do.
Yep.
That is
Yep.
not my job. So we do, as therapists, have to lead with more of that motivational interviewing type of spirit, where we ask, Socratic questions, Socratic questioning. We really allow them to be the person to lead us into the direction that they want to go to. For example, if a client is engaging in increased sexual activity, we have to start talking about, okay, well, what do you feel? What do you feel like you get out of those sexual encounters? Maybe they've had terrible sexual experiences in the past, and maybe they think that it's rooted in that, but we can go even further than that. So we just have to approach the situation with this honest curiosity. We don't have all the answers. We're on the journey right along with them. We just have, maybe a few tips and tricks on how to get there that maybe the client doesn't know. But we really have to lead with that natural curiosity for sure. So a lot of questions that we have, and clients definitely get a little annoyed with me and all my questions. But at the end of it, it really does serve a purpose. It really does. And usually they start to see the threads connecting themselves, which is such a beautiful moment for a lot of people. But it does take time. And again, going back to those safe environments, it takes time to build up to that point. And so nothing is going to be resolved within a couple sessions. It's very doubtful it's going to happen because it's rooted so much deeper than what the client even realizes.
Yeah. Could you, for listeners that don't know what you mean, could you tell us what you mean by Socratic questioning?
Sure. So Socratic questioning are questions that ask, who, what, where, when, why. So we're thinking we're thinking a lot about the types of, it also kind of depends on what's given to me too. So Socratic, I don't know. I'm trying to think of another way to define it. I'm even looking it up just to make sure I get the definition right.
No, that's great. That's great. I
think of some examples. Oh yeah. Okay. So a lot of people may put them in that bucket of typical therapy questions. Like, what do you mean by that? Can you give me an example of that? What are the consequences of this? How do you know that this is how they felt about this? You start to really ask them to dive deeper and deeper and deeper. So it's much more, it can start with who, what, where, when, why. What do you mean? But it can lead you in so many different places.
Yeah.
A lot of clients probably get sick of those types of questions because it does force them, it forces them outside of their comfort zone, right? But yeah, those are some of the types of questions that might be asked. Yeah.
What about when you are working with a client, and this could be a kid or an adult, that doesn't really have a lot of safe support around them? How do you navigate that with clients?
I think, if you don't mind, I can take over this, Dr. Sable. I think for the most part, support is usually, from what I can experience with my clients, support is usually, people assume that it's family. But there's so many other supports that you can have within the LGBTQ community, friends, starting there. And then 2, just looking at and psychoeducating of all the other supports that are located in your community, of groups, of other environments that they can be safe within. So I think it's very, especially in the LGBTQ community, it's so common to feel so alone and insecure and unsafe and all those things. But reminding again, there's so much more out there than just the family, especially if you don't have a family that supports you at that time. Friends, environments, like I said. But if you have anything to add to that, Dr. Sable.
Yeah, no, I think it is really challenging because we also have to, this does come up quite a bit where we will have parents that have access to the chart and the child doesn't. And so that does come up.
That's a great point. So, I mean, children have a right to confidentiality, but how do you navigate that?
I know for me, I'm very careful about the types of things that I put in my notes because a parent can ask for their notes at any time, and they have a right to the information. But at the same time, absolutely, teenage clients, children clients, they have a right to privacy as well. And so in cases like that, I always let the child know that, hey, your family has asked me for this. There might be some things in here that cause some questions. And that's a hard conversation to have with them. But really, you start having that conversation from the very beginning. You don't do it after 20 sessions that you've had with them, and then all of a sudden, oh no, all my secrets are going to be revealed. You really have to start having those disclosure conversations at the very beginning, not only with the client, which in this case is a minor, but then also the parents too. You have to have the conversation with them as well. I mean, there's all sorts of paperwork that they have to sign and safe harbor agreements and all these types of things. But nothing is better than having a frank one-on-one conversation with a parent, and then also a conversation that brings in the client, the minor client too, where we talk about the fact that there's going to be some things that we discuss as therapist and client that need to remain between us, but I will always advocate for them being open and honest with you. But please know that if you request records or you start to ask them a lot of questions, it might harm your relationship with them, just as parent and child. And usually parents are very open to that, and they know that they don't want to harm that relationship at home, because those relationships are going to last hopefully a lifetime, right? So they take those words of caution pretty seriously, but it's still a battle sometimes, though, or it can be.
Yeah, and just to speak on that a little bit too, luckily LA Mental Health, with the intakes and the profiles that we create for the clients, there's preferred names, there's identified gender, there's pronouns and stuff like that. That's their parent can access that anytime, kind of like what Dr. Sable was saying too. So what I do during the intake as well, while we're having conversations of confidentiality too, and if that's something that they disclose at the time, that they go by a different preferred name or pronouns that their parents are aware of or their caregivers aren't aware of, I have that conversation of, do you want me to put this on your chart? Because once I put this on your chart, they're going to access it, or even when I'm writing a note, do you want me to use your preferred pronouns, or do you give me permission to not use the preferred pronouns just for your own protection? So again, just being very open and honest between the therapist and the client, just navigating that sticky situation sometimes.
Yeah, absolutely.
Those are such good suggestions. I'm going to pivot a little bit because there was one thing that was said earlier that I think kind of relates to this, but thoughts about the gender dysphoria diagnosis, because I think that that's something that I know that historically, historically the APA said, being gay is part of the, DSM. It's a mental diagnosis. Yep. And so I think there's a really icky part of me that isn't sure if I should be diagnosing people with gender dysphoria. Yeah. And then also because there's a part that feels icky to that. And so curious what both of your thoughts are. I don't know if this is something that's controversial, but I'm just curious. Yeah.
I'll start because I have a lot of thoughts and feelings that I'll share very, very briefly. In my work, I've experienced that again, I deal with a lot of minors, so excuse my language, I'll be focusing on minors, but in the cases of minors, sometimes when they want gender affirming care, they cannot receive gender affirming care, at least from what my experience is, without that gender dysphoria diagnosis. Yeah. Do I think that it is a mental illness or should be in the DSM-5? Absolutely not. And that's just, again, part of LGBTQ was in the diagnose or in the DSM-5 before, and that has changed. And I think gender dysphoria should be a part that is changed. But right now in this situation, in order to give clients gender affirming care, that is something that I do have to diagnose them with in order to provide them that. Do I think I have to? No, but for their mental health going forward, it's something that I have to do, unfortunately.
Yeah. And unfortunately, it's treated as a negative label in a lot of ways.
Yes.
But like you said, it can when it's properly used by other entities, it can be used as a way to open up so many more doors for them.
Absolutely.
And you can support them in your clinical judgment as best as you can on paper. So I have some mixed feelings about it as well. Just based on the horrible history and the many things that people had to go through after they got that diagnosis. Back in the 60s, 50s, 60s or so, when it was still a mental health condition. And so it kind of does feel like a little bit of a step backwards. That here we are again, diagnosing people with something that is so integral to their identity and doesn't need to be quote unquote fixed, like bipolar disorder, schizophrenia. There's other things, substance use issues that people want to fix, but this is not something that people necessarily need to change about themselves.
Agreed.
But there definitely does need to be much more of a call to action when it comes to helping people understand this diagnosis and what it can mean or what it should mean in other entities across the healthcare spectrum. Because there's definitely a lot of good that can come from it. But, being someone that is from Texas, we've gone through a lot when it comes to all sorts of different populations, but especially when it comes to gender affirming care. And so, I share your thoughts for sure. But
and I think that of the clients that I've worked with that have been diagnosed with that, they carry other diagnoses too. Like perhaps they're they're working on their anxiety with me, or they're working on ADHD, or different things. And so that's never, at least in my experience, it's never been the only diagnosis that they're carrying.
Absolutely.
I want to explore that a little bit though. Why do you think that having that diagnosis opens up doors? Because I just don't know what that would really be or how that works.
You kind of mentioned it a little bit, Amber, how you are able to get certain services whenever you do at least have that gender dysphoria diagnosis.
Correct.
You now have somebody co-signing you that you're not going through a phase, that you're not, even if you do change your mind, it doesn't matter if you change your mind or not, you are at least identified right now as having this thing that you want to take care of that is personal to your own diagnosis. Now you can work on all of the other co-occurring disorders because, which one of us doesn't have a co-occurring disorder? I'm sorry. I've got about 3, right? Like there's a lot of things. We're complicated individuals, but again, it points back to having deeper conversations about the root of all of those other co-occurring issues. For a lot of people, if you had to disguise or hide or deny who you are, wouldn't that give you anxiety? Wouldn't that give you a substance use disorder? Wouldn't that make you act out sexually? There's so many things that can be wrapped up in gender dysphoria. So it can explain some of the behaviors. And it's certainly a good place for us to possibly start working with them in a lot of different ways. So like I said, it's a double-edged sword. And I think we're still working out the kinks and getting rid of some of the historical bias and discrimination that people have faced. But it is still a possibility.
No, I appreciate you sharing that because that's just something that I wasn't really sure why that was like or as a therapist, if I should be diagnosing people. So that's super helpful for me to know.
Yeah, it's a little scary though. I totally understand why it would be scary for a therapist to do that, especially someone who does want to be gender affirming and welcoming and all of this. And I think it's, again, going back to having honest conversations with clients about their diagnoses, right?
Yeah.
Letting them know like, hey, this is what I think you have. And even if they are not aware of the history, maybe sharing some of that history with them. Like in the past, people have done this in a negative way. We're doing our best, and I'm going to do my best as your therapist to advocate for you because we're in a totally different headspace right now as a general society, not always, but we're generally in a different space as a society. And so here's what I'm going to do. Here's what this diagnosis means for you at this point. Doesn't mean there's anything wrong with you, but it does mean that you can get access to other certain things. And it does explain some of your other behaviors. And so if it's explained in that way, in a more gentle, affirming way, usually clients are pretty open to it.
Yep.
No, that makes a lot of sense. Gosh, I'm trying to think of where else we want to go with this episode. What are some thoughts that you guys have? Like, what are some other aspects that you feel like if you're a new therapist and you're trying to be gender affirming, you're trying to show up for this community, what are some things that they should be keeping in mind, or maybe even educating themselves more about?
Amber, you'd like to start?
Yeah, I think I'm forgetting what the actual term is, but I think it's person first language, of just being mindful of who you're addressing. They're not, kind of using gender dysphoria. If you say a gender dysphoric person, or you can say a person first is someone who has gender dysphoria. Just being mindful of language too, of like, using partner versus boyfriend, girlfriend, unless they already consent to, like, I want this person to say that I have a girlfriend. I think just doing your part and being educated of how to navigate certain situations, learning how to use the language, stuff like that. And I also think, don't be afraid to ask your clients, not that, again, kind of like what Dr. Sable talked about earlier, not that people are forced to educate you. You should be educated on your own, but it's also great to, like, okay, well, how would you like me to address this? How would you like for me to address your partner, or so on and so forth too? Again, going back to the core of safety.
Yeah, that's an important reminder too, to use person first language. We don't see enough of that by any means. We might say our trans client. I'm like, no, baby, that's not how you say that. But yeah, there's so much to say about this, honestly. So I'll piggyback on some of it and just hit the highlights. Honestly, it's important to remember too that we are, even if you don't necessarily identify as exactly the same things as your client, you are a guest in their home in a way, and you need to behave as such. Going back to kind of what I mentioned before about, being part of monolithic cultures, we are not monolithic at all. The LGBTQ population is not monolithic. And so there might be slang terms that and that you want to show off and that you are so super, super proud of because you took a class and you know what this means. That doesn't mean that client wants you to use that. It doesn't mean that client even likes that language either. And so it's really important to take a culturally humble approach and ask them, how does this show up in your life? What would you like me to do? What does this mean for you? There's a lot of subtleties, and I kind of alluded to it before, but there's also certain power structures too within the LGBTQ community. So there's different experiences that we have to take into account. Yes. The experience of a white gay man is going to be different than the experience of a Hispanic or gay or Hispanic, Black, Asian, etc. gay man as well. So we have to understand that just because we know a little pinch of something does not mean that we fully understand the bigger picture. So really taking our time to ask those questions, ask the Socratic questionings. What does this mean for you? Can you explain this a little bit more for me? All of those types of questions really allow us a deeper picture into that client's world or into their house. Because like I said before, we're an invited guest. They can ask us to leave at any time. Yeah. And we certainly don't want that. We want them to feel safe with us. And so it's incredibly important to take that approach, that person first language, that culturally humble approach. And again, going back to culturally humble, it's important to know what your biases are too, and point it out as soon as you can. If you want to point out the power differential between yourself and the client too, I think that's important. Like, hey, I understand that, you're talking about your experiences with this particular community and I kind of represent that community. If you don't feel safe with me, I want you to call that out, and I'll call it out in myself too. And so taking the time to also recognize that there might be some things that you're bringing to the table that might sully the relationship is important too.
That's awesome. I mean, even just the words that you're using, I think are really powerful and would be really helpful for people to keep in mind. And I mean, of course, if you're listening to this podcast, hopefully that means that you're taking some steps to educate yourself and trying to learn more. I'll add some links in the description as well of different resources that I've found that I think can be helpful. And whether it be navigating different language or navigating labels or, like just different things like that. Because I think that the more we can be educating ourselves and trying to, take that humble approach, I think that the more helpful that will be for the client in the long run too. And you're not going to be like, oh, wait a minute, what does that mean? Or, I think that can make a big difference.
Absolutely.
Yes.
Do you think that there are times when a therapist shouldn't be working with this population? Like based on their own biases or based on, I don't know, or do you think, this was a question that actually came up in a Facebook group that I'm in recently, and people had super mixed responses on like when a therapist shouldn't, like if they don't identify as queer or part of the LGBTQIA plus community, like when they shouldn't be working with this community.
I think my answer to that is what is beneficial for the client. Like kind of talking about Dr. Sable's bias, like do you think that you could work with a client and be open-minded and be humble and learn? Again, not that these people are your educators, but like can you be open-minded and assist this client open-mindedly? I think if you are a therapist that is very strict on their biases, and there's some people that are out there that they know what population they want to work with, they know who they vibe with, and they're not looking to switch whatever, that's okay too. You can have your own thing. But I think at the end of the day, if you know that you are not going to be open-minded, that can hurt the client and the rapport and their journey in their mental health, then I would say that that's not beneficial. I don't think it's more so on the therapist part, but like what is beneficial to the client at that point? I don't know if that made sense, but.
Yeah, that makes perfect sense. Mm-hmm. Yeah, I think I totally agree, first of all. There should be much more deep diving that you need to do in yourself to see if this is a client that you or a population that you want to work with.
Yes.
Do I think if you've been working with a client, you need to immediately drop them if they start to show signs or something that they might not be on the same page with you or as your beliefs at least? I don't believe that that's beneficial for a client either because they've built rapport with you. But I think it is a conversation for you to have with them and be open and honest with them, saying, you know what, I've never worked with people who identify as trans or as non-binary, and I'm going to navigate this as best as I can. But if you would feel more comfortable working with someone who does have experience with that population, I'm happy to start to transfer you over to someone else or see you for a little bit of time as you get more accustomed and build rapport with that other clinician. There's all sorts of gentle ways to make that transition easier for them and also, pretty decent for you. Yes, you're losing a client, but at the same time, you're gaining hopefully their respect in the long run.
Sure.
There's plenty of people that don't have the experience working with all sorts of different populations, but we do our own education, we do our own research, we read books, we read articles, we talk to other therapists that have worked with that population, and hopefully we can gain a little bit more understanding. But if it really is a deep-seated belief that you have, then maybe that is something that you need to work on with your own therapist and see if that's something that you can overcome in some way, or if that really is just a part of your identity is someone who doesn't necessarily believe in the lifestyle or whatever the case may be. But there's certainly an opportunity there for deeper exploration on all sides.
Absolutely. And an opportunity for supervision in those circumstances too. I mean,
absolutely.
I think that as new therapists, we need to be constantly thinking about like, what am I equipped? How am I equipped? What are my biases? How can I be serving my clients well? Amber, I think that you nailed it where you were like, what's beneficial for my client? And then really taking a critical look and talking about it in supervision, because that's what supervision is really, really crucial for, where you are reflecting on your own practice and saying, how can I be improving? I think, and being vulnerable and talking through some of these things with your supervisor is absolutely crucial.
You actually mentioned something too I want to piggyback on, because I actually just had a 6-hour-long CEU thing for the upkeep of my supervisor license. And something that we actually talked about was providing supervision to a LGBTQ identified therapist whose clients expressed a bias and a dislike of LGBTQ clients, which does happen.
Yeah.
Not everybody comes to us that knows who we are and what populations we represent, what demographics we represent, and how to navigate that situation. In situations like that, Amber, you can also share, please. In situations like that, I know I've been in kind of similar situations where I was on the phone with a client and they didn't know that I was Black. Quote unquote, I don't sound Black. We hear that all the time, right? But they did not know that I was Black, and they used a racial slur when they were talking about someone else in their life. And it was really hard for me to stay on the phone with this person, even though I knew that they were not directing it towards me. Just the use of it was incredibly harmful and hurtful. Thankfully, I had supportive coworkers that saw my face drop and they were wondering what was going on. And so I'm typing to them saying like, he's saying this right now, but I had to still support that client because they were actually in a heightened state of suicidality. So I had to stay on the phone with them until someone came and checked on them. So I had to unfortunately put my pride aside a little bit in order to get them the immediate help that they needed. But I never talked to that client again. And so in situations like that, I always tell people, take care of that immediate situation first if you have to, if there is a sense of urgency in it. But if you don't feel safe, there's no reason for you to continue on with that relationship, because if they've expressed something directly towards you, then why are they coming to you in the first place if they know that is something about you? But yeah, you have a right to safety as a clinician. You have a right to live your truth and live your life in the way that is best for you. In that case, you may need to part ways with that client.
Yeah, just to piggyback off of that, I do have some clients that I don't share, we're on opposing sides, to sum it up.
Sure.
But I think there's a level of, where do I feel safe? So at least, luckily with some of my clients, I feel safe. That's a topic that doesn't really come up in their presenting problem. So it's not something that we address. It's something to keep in the back of the mind, just so I can be safe in my person and they can be safe in their belief. But again, luckily, going back to open-mindedness, we can navigate the bigger picture being open-minded. But I think at the end of the day, kind of like what you were saying, Dr. Sable, back to safety. Again, safety. Client safety is great, but also your safety is important too. You should be safe with working with your clients. And if they are making you feel threatened or unsafe or anything like that, you have every right to also be like, I don't think this is a good fit. You can try to navigate that if you want to, but you are not at all obligated to. You can say like, again, I don't feel safe. I can refer you out. Here's some resources. And that's it.
In those circumstances, in either of the circumstances that you both are talking about, would you tell the client point blank, like, this is why I'm referring you out? Or would you say or would you just say like, after our last conversation, I don't feel like I'm a good fit for you. Like how much detail would you go into? Or would you just kind of leave it vague?
I know for me, if it's a newer client and it hasn't been something that has ever come up before, like in our initial conversation, or like the first maybe 3 or 4 sessions, I'm a little bit more direct. And so I might say, you know what, you mentioned this during our last session, and this is the reason why I think you might have a better fit with this other therapist, and this is why.
It's only so happened. Brave.
Yeah.
That would be hard. I just want to say that's hard.
I've worked a lot of CPS cases. So that's where the bravery comes from. The honesty has to come from, because if somebody's going to come knocking on your door about something, we want to give them a reason why. But if it is a client that it's been more of a longer relationship, I'll probably do the same thing because we have built that rapport. I think it's important to try our best to be as open and honest with all of our clients. With the newer clients, you may not be as detailed. You may just give like a little hint. And usually people can pick up on context clues. For a longer client, a longer standing client, I would probably be a lot more detailed. Like, hey, this hasn't come up before. This is what I'm gonna recommend that we not do this anymore. But if you need help in that transition, I'm happy to help.
Yeah, I second that too. I'm a very forward person too. So, and again, like there's nothing wrong with just saying like, hey, this is how I identify. You said some things. I just don't feel comfortable. Again, resources. And so I think, depending on the environment, like Dr. Sable was saying, and how safe you feel, that's also something to consider as well.
Yeah.
Well, this has been such a good episode. We are over time, but thank you both so much for joining and really starting off this conversation in a really great way. I think that this is a lot of really good information, and I'm excited to dive deeper into this topic and really explore more about how we as therapists can be showing up for our clients in the LGBTQIA community and how we can keep ourselves safe, be brave, show up. I mean, do the work. I think this is so helpful. And so thank you both so much for joining.
Thank you, Miranda.